Welcome back. I'm Jen. I'm a holistic family consultant and a parent coach, and I support queer, non monogamous, and neurodivergent families with all the challenges that come with parenting outside the box. And today I'm talking to Jacob, and we're going to be talking about birth and supporting a birthing parent within non monogamous relationships. Do you want to introduce yourself, Jacob?
Yeah, my name is Jacob Englesman. I am an IBCLC, which is an international board certified lactation consultant. And I also trained as a postpartum and birth doula, although I don't do so much doula work right now. And I am the author of Lactation for the Rest of Us, a guide for queer and trans parents and helpers, which just came out early this year, 2025.
Thanks for being here. So, in this
Thank you
video,
so
we're going to talk about birth, and you can find in the description the link for our other video talking about lactation. And we're specifically aiming at families that are non-monogamous that are having children by choice, because most of the resources that exist so far for non-monogamous parents are assuming that you had the kids and now you're becoming non-monogamous. And in fact, there are a lot of families that are non-monogamous first and then choose to have children. And I hear a lot of fears from people about what is that going to be like, supporting the parent who's actually birthing when there are dynamics that society has not taught us how to support. So, do you want to tell us a little bit, Jacob, about what are the things that you think about when you think about, you are not the parent giving birth? How do you support the parent who is?
Yeah. So when I'm having conversations like this, terms that I generally fall back to are gestational parent and non-gestational parent, which is not to say that those terms are any more correct than other terms. They're just the ones that I use. So for the sake of conversation. um, so I think one of the biggest things that comes to mind when people are talking about having kids and the like the birth process itself, right? Not like the having children at home and all that goes along with that, but like if you have multiple partners who, for example, gets to be in the birthing room with you, and how do you handle that if multiple people do, and you're not necessarily comfortable with that. Even if you're having sex with somebody, you may not necessarily want them seeing you give birth. And I think especially with people who don't have any experience with birth, that can be, they don't necessarily like understand why that might be a choice that a gestational parent or birthing parent is making, right? That, yes, I love you, but I don't want you in the room while this is happening. That can feel like really personal and upsetting. And and I do think that this is something that, to different degrees, every birthing parent goes through, right? Like when I was a doula, one of my jobs for a specific birth was keep Auntie so and so out of the birth room because she just showed up and was not invited. But it is definitely different when it's somebody that you might be in love with, but you still have to, and so then you have that layer of navigating. And I think, as with all things polyamory and non-monogamy, one of the biggest one of the most important aspects is just like keeping really open communication and just being for both partners for in that conversation, and just being, you know, extremely humble. And since we're talking about people who are already polyamorous, right? Not people who are opening a relationship after they have kids. That's a whole different conversation. For people who are already polyamorous, hopefully they already have experience with open communication and a certain amount of humility in difficult conversations.
Yeah, and also hopefully you're finding this video before like your due date. Hopefully you're having these conversations either, you know, while deciding whether to have kids or during pregnancy. So there's time. There's time for, you know, people to process their feelings, because some partners also, you know, some gestational parents might be like, I want all my partners there supporting me, and some of the
Yeah.
partners might be like, I am
Oh
super
yeah.
not comfortable with that.
Nope.
I don't want to be a part of that. So
Which is okay too, right? If you
yes,
invite somebody to your birth room and they respectfully decline, like that's a valid choice for them to make. They're not comfortable with that.
yes. Yeah, so really inviting those conversations to start early, and like with most things about polyamory, where there is no like defined, this is the way we do it, the way
Right.
there is with monogamy. So there's all this space for creativity and for, you know, who has what role, and maybe one person is not comfortable being in the room watching birth happen, but they're, you know, enthusiastically want to be the person who like makes the phone calls to let all the grandparents know that the baby has arrived, or,
Yes.
you know,
Yeah.
like the or maybe they want to be the person who is at your house cleaning so that you can come home to a space that is like doesn't require any chores to be done, or
There is so much
yeah.
that needs to be done, even if you are not in the birth room helping that way, right? Or the person who will 100% answer the phone at 3 o'clock in the morning because they forgot something extremely important when they went to the hospital.
Mhm. Yeah. Yeah, or someone who would, you know, be the on-call person to come over and take care of older children, you know, while you go be busy giving birth. Yeah, so really bringing creativity to what can people do and how can they be involved, and what people's comfort level is, and also in understanding that um, having a baby changes relationships regardless of the structure of relationships,
Mm-hmm.
and that's okay. That's not, you know, because one of the things I hear a lot is a fear of, if I have a baby in this one relationship, what is going to happen to my other relationships? And the answer is we don't know.
Sure.
We don't know, but having that open communication and talking about it, and having the flexibility and the grace and the humility to allow people to grow into whatever that's going to look like for the people involved.
Yeah. Well, and by acknowledging the fact that the relationship is going to change, right? And not convincing yourself it's not. By acknowledging the fact that it's going to change, you can then to a certain extent guide how the change is going to happen once you accept that the change is inevitable.
Right. Right. And ideally this is way before birth that you're deciding whether that's something you want to accept for your relationships, that they are going to change, and that, you know, becoming a parent is something you want,
Mm-hmm.
and you're going to accept the changes in your life that come along with that.
Right. And, you know, and maybe the change is I'm going to disappear into my house and not see anybody else for 3 or 4 or 6 months. And if everybody knows that ahead of time, it's way easier for that partner who, might otherwise be feeling abandoned, right? If everybody knows this is probably going to happen, and that's okay. And then they can also make the choice that, like, no, that's not okay, and I'm going to move on with my life, which, sucks, but is also a
Yeah.
choice that people make.
Yeah. So why don't we talk just a little bit about, actually during the birth, is
Yes.
there, I know your book talks about this more. So I want to encourage people to see that as a much more thorough resource about birth and lactation. But, if you had to give people like a couple of bullet points of if you're going to be supporting someone giving birth, what would you keep in mind?
So I think one of the big important things is that somebody needs to make sure that all of the hospital staff knows what's going on. And I talk about this a lot in my book, in terms of queer families, but even with polyamorous families, right? Like, there might be multiple people who are being referred to as the father, and or any number of situations, because polyamory is fun like that. So somebody needs to make sure that the hospital staff knows who everybody is, right? And isn't assuming that this person is a sister or a cousin or something like that, which can lead to awkwardness for all parties. And that, yeah, and that, like, these people, some more than the expected number of people in the room are in love with the person giving birth. And so, yeah, so I think making sure somebody is talking to the hospital staff, because even your OBGYN might already know, right? But the floor nurses, you don't know who the nurses are going to be ahead of time, because you don't know
Right?
what
You
time
don't
you're
get to
giving birth.
pick them.
Um,
Yeah.
so, and making sure that if they're not cool, maybe you can see what you can do to get nurses who are more sympathetic to your situation, in the room, and at least ones who are just not going to be rude about it.
Hmm. Yeah.
And then, in terms of when labor is happening, I think one thing that people need to understand right off, especially if they've never been in this situation, is that most of labor, uh, in a hospital, in my experience, the vast majority is waiting.
It's very boring if you're not the
Yeah,
person in labor. Yes.
I didn't want to be the one to use the word boring, so I'm glad you did.
It's not boring if you're the person in labor. Probably don't tell them that you're
Right.
bored because
Um, but yeah, so, well, and not looking bored, right? One thing that I recommend people bring, like, put in their birth bag, is a copy of their favorite book and their partner's favorite book, right? Like, their comfort reading. Because there's going to be a lot of waiting. And, even if, somebody can't necessarily read, like, while they're having contractions, different people have different, pain tolerances for things like that. But, like, if you can read their book, their favorite book to them, that could be a lovely gesture. So, yeah, bringing things to help pass the time while the birth process is happening, because And then at a certain point, you're going to go from like 0 to 60. And then it's like, oh, baby's coming. But one thing that I tell a lot of people, I used to do a class for first time fathers, is to practice and get really good at saying yes, dear, without sounding sarcastic or annoyed. Because like for as long as they're in the hospital room, like just do whatever they ask you to do.
Yes. Yeah, and that was going to be something that I was gonna say from my own experience of having birth two children, that the person birthing needs to drive what's happening. So, even if you all talked in advance and you had plans, if those
Mm-hmm.
plans need to change, if you are not the person birthing, you are not the person who changes those plans, and you
Mm-hmm.
are the person who rolls with it. If somebody is like, I thought I wanted you to read my book to me, and now if you speak, I'm going to kill you, then you
Mm-hmm.
don't speak. You be quiet.
Right. Right. Yeah. Yeah, outside of the medical professionals, there is the person giving birth, and there are helpers.
Hmm.
And if you are not a medical professional who's at work, also, by the way, right? Even if you are an RN, if you are there as a birth partner, don't argue with the other nurses.
Yeah. So two things that
Your
I hear
role is as
there
a
is,
helper.
one thing is like, how can you help the person birthing feel more comfortable, feel more relaxed, feel cozy, because all of those things help birth happen easier and help it be less painful and potentially less scary, depending on the person and their needs.
Right.
And then the other
You
thing that I heard was like almost being a bouncer,
mm,
keep out people who are not welcome. And if there is anybody who is being rude about the situation, try to insulate the person birthing from dealing with those people directly, because th've got other things to focus on.
right, right. You want to do everything you can to stimulate the production of oxytocin, which will help the birth process. And in my experience, polyamorous people talk about oxytocin a lot, but maybe it's just because I'm also a birth professional. So,
Yeah,
um,
oxytocin is the love hormone,
yeah,
is the nickname for anyone who doesn't know. So like, when you cuddle, that kind of that warm fuzzy feeling, that's oxytocin. And oxytocin is very important in birth and lactation, and also in like bonding and love among partners. Yeah. All right. Do you have any last thoughts about birth that you want to make sure that people know if they're going to be a supporting partner?
honestly, just to reiterate that, like, do whatever you're told.
All right. Thank you, Jacob. And for everyone listening, please do pick up Jacob's book. There will be a link in the description for this, because it is really a wonderful and thorough resource, and especially for people who might feel like they're not really seen by sort of the mainstream birth and lactation books that assume that you are a cis, monogamous, hetero couple. Jacob's book does not make those assumptions, and it's wonderful and inclusive.
It did occur to me just now that there is a point which we may have missed, since we're talking to people who may not necessarily have experience with birth, which is that I said that I was a doula and I made reference to doulas. Okay, so what a doula is a birth. And I feel like no matter how I define doula, there's going to be some doula that's like, well, actually, um, because there's a lot of them and they do a lot of different things. But um, a doula is essentially a birth helper, like a professional birth helper. Sometimes they'll also refer to themselves as like a birth coach, but they are not necessarily a person who delivers babies. So
Hmm.
like an OBGYN or a midwife is a medical professional who delivers babies. Doulas are more people who support the parents during the delivery process. And if you can, and if you, the thing about doulas is that even if you have a lot of support, if they don't know a lot about birth, right, even though they're providing emotional support, a good doula or an experienced doula has attended like perhaps hundreds of births. So that definitely might be something that you want to consider when you're thinking about your own birth plan uh, and
Yeah.
how and what your needs might be, right? Do you feel like emotional support will be enough if you're having several medical professionals, or do you think you would also like somebody who has been a birth helper or assistant for a lot of people? And then of course there are new doulas who have only attended a couple of births, but
Yeah.
they need
But still,
experience.
yeah, and especially if like cost is a factor, newer
Mhm.
doulas often offer a lower rate, or if if they're trying to build a practice. And they still have a lot of training about birth, even if they don't have a lot of births under their belt yet. But I would agree. I cannot highly recommend enough having a doula.
Oh,
Yeah,
I was going to ask, did you have doulas?
I had doulas in both of my births. The first one was a planned hospital birth, and I insisted on a doula. And my partner was like, "I don't know, it's a lot of money." And about a week afterwards, he was talking to a friend. I overheard him say, uh, "That was the best money we spent. Far better than like any baby stuff we bought. Far better than anything." He's like, "I can't imagine if we had tried to have a birth without the doula, because." There were so many times when even though my partner had done a lot of birth education during the pregnancy, where he just kind of was like, I don't know what to do, and the doula was like, I do, I got this.
Right.
And and she was a support for him when he got nervous, and she was the bouncer when we needed. I mean, she was such an incredible help. And the second birth, and I'll just say this because I've heard from people who plan a birth with midwives or plan a home birth, and they're
Hmm.
like, they think that they're expecting less hostility, and so they sometimes forego a doula.
Hmm.
And with my second, it was planned as a home birth with a midwife, and having the extra set of hands
Yeah.
available what turned out to be equally invaluable, even though my partner and I both knew what we were doing more, since it was our second go round, and we didn't have as many staff coming in and out and that sort of thing. Although in the end I transferred and she was invaluable at the hospital as well. But yeah, I cannot recommend enough having a doula, and that is a totally valid thing to ask for people to help fund at a baby shower or something like that,
Oh, yes. Yes.
if affording it is an issue. But yeah, doulas are wonderful.
Good.
All
I'm glad we got that in before we cover the.
Yeah. And you know what? If you are a doula, especially in the Denver area, since that's where I am and where I know a lot of poly families, if you're a doula who is friendly to the polyamorous community, get in touch with me, because I would love to be able to have somebody I could refer who is not going to like give side eye to somebody when they start talking about their partners. So,
Hmm.
yeah. All right. Thanks, Jacob.
Yes, absolutely. Thank you so much for having me.